As depression, anxiety, and suicide increase among children and adolescents, the demand for mental health care for kids is outpacing the supply.
Yeah, there are not enough programs or caregivers in our community and others across the country. It is to the point where patients are often told they have to be patient, even in a crisis. Jake O'May is back doing things he loves, like fishing with his twin brother. But his recent struggle to access mental health care in Rochester was an eye-opener for Jake and for his father.
The scariest thing for me was, seeing my son who was there in an acute state trying to get psychiatric help.
Scary? Yeah. It was definitely scary. It was.
After the suicide of a friend at Penfield High, Jake, who had dealt with depression and anxiety since 5th grade, was having thoughts of suicide himself. Last May, he spent 70 hours waiting in the Comprehensive Emergency Psych Unit at UR Medical Center. It's called CPEP for short, and it is the only path into the region's only child psych inpatient unit, also at URMC. CPEP is a place to keep patients safe until there's an available bed, and that might not be in Rochester. Jake happened to be in CPEP during one of the unit's busiest weeks ever.
They told us initially we could possibly go to Buffalo, but once you went there, you'd be stuck there.
Jake's dad has heard many stories about the kids who get excellent care at Golisano Children's Hospital. But he worries about what he calls the other children at Strong.
Golisano Children's Hospital is a blessing for our community. But here they are, just the night before, I see 35 kids, sleeping in various states on the floor, on chairs, with blankets, with a pillow, and just left there. Who knows about them? Who knows that they're there, a 5-minute walk away from that part of the hospital.
Jake did get inpatient care at URMC. He and his father are grateful, but they hope that by sharing their story, the system can be improved.
Awareness, but that's a very ambiguous word. But again, if I didn't know that the adolescent teen psychiatric mental health options were so limited and so strained in Rochester, who else doesn't know?
This is the only place that we have. Let's make it as the best that it can be.
In addition to sharing his story, Jake is now raising money to buy a piano for the inpatient unit at Strong. There is more information on 13wham.com. And new tonight, the most serious shortage in the system is not in the psychiatric ER or in the inpatient unit. Why the chief of child psychiatry at URMC says better access to other kinds of care may be a solution to the crisis. We'll continue our special report on 13 WHAM News at 10 on Fox Rochester. Of course, he's talking about different forms of outpatient or partial hospitalization care. The expected wait time in our communities to see a child psychiatrist is 12 weeks, even if it's an urgent situation.
I've heard that time and time again from parents. 1 in 5 children suffer from some kind of mental health issue. If your child breaks their leg or has a cold, you go to urgent care, but there isn't anything for these families.
And of those who have a mental disorder, only 1 in 5 of them will actually see a mental health care provider. So more at 10 tonight.
All right, we'll look forward to it. Thank you. Accessing mental health care for children and teens in our community can be an exercise in frustration. A shortage of providers and programs means patients must be patient. As 13 WHAM's Doug Embledge reports, more prevention, though, may be the cure.
On the wall of Dr. Michael Scharf's office, there's a quote from Frederick Douglass. "It is easier to build strong children than to repair broken men." That is the core of his mission as chief of child psychiatry at the University of Rochester Medical Center.
Child psychiatry is the most underserved medical specialty in the United States and in all of North America.
Jake O'May doesn't need to be convinced of that. Last May, the Penfield teen who has battled depression and anxiety spent 70 hours in our community's only adolescent psych emergency room waiting for an inpatient bed. And while a wait that long is not typical, it is not uncommon for teens having a mental health crisis here to be told that the next available bed might be in Buffalo or Elmira.
Scary? Yeah. It was definitely scary.
Dr. Scharf says experiences like Jake's are symptoms of a much bigger crisis in mental health care, both here and across the country.
The biggest shortages in our community right now are actually not the hospital, not the emergency room, but the outpatient practices and partial hospital service. The challenge we have is even when we can predict what the volume will be in the hospital, we don't have enough outpatient programs, enough lower level of care programs to prevent admissions, which could be preventable.
A study done for the Greater Rochester Health Foundation found as many as 20% of kids under 18 have mental disorders. Yet in our community, only 1 in 5 of them will see a mental health provider. And most who get care will have to wait for it. The expected wait time to see a child psychiatrist in our community is 12 weeks. And Dr. Scharf says the cost to all of us must be measured over the long term.
And we're talking about kids who can fail to reach their full potential, who can continue to suffer with conditions such as depression and anxiety and have lost days of work, disabilities, other health conditions that can develop, and then lead to other health costs that continue throughout their lifetime.
Good news on the prevention side. More primary care practices now include mental health care providers. Awareness of mental illness has helped erase the stigma of needing help. And Dr. Scharf says he's encouraged that more medical students are willing to take on the extra 2-year fellowship required to become a child psychiatrist.
It becomes very clear that if we're serious about healthcare reform, child and adolescent psychiatry is the essence of healthcare reform.
The most important thing.
I believe so. I believe so.
Dr. Scharf says they are working toward a time when there would be no waiting lists, when quality mental health care could be accessed quickly with a telephone call. Doug Embledge, 13 WHAM News at 10 on Fox Rochester.